About 18 million people globally die in unavoidable pain and stress due to lack of access to pain relief medications and quality palliative care. Only 14 million patients who need palliative care get it at the end of their lives. Palliative care is a pain relief medication for patients suffering from chronic diseases such as cancer, diabetes, emotional suffering of patients with kidney, and tuberculosis, among others. It is estimated that every year more than 20 million patients need palliative care at the end of life, and in 2011, approximately 3 million patients received palliative care, the vast majority at the end of their life. 80% of the global need for palliative care is in low and middle-income countries that rarely get this service. Based on the magnitude of the problem, Uganda has been chosen to host the 5th International African Palliative Care Conference this month.
And it's scheduled to take place from the 16th to the 19th of this month, August, at Speak Commonwealth Resort, Munyonyo. The conference will be held under the theme, Hospice and Palliative Care, from Resolution to Action. Differentiated care for diverse communities. The conference aims to bring together patient groups, ministers of health and other government departments, education institutions, the palliative care service providers, and advocates, researchers, donor and other development partners from Africa and across the globe to share best practices and research results with a view to improving access to palliative care for people with life-limiting conditions such as HIV, cancer, and many other diseases.
A survey carried out by Hospice and Palliative Care Services on the African continent in 2014 indicates 45% of the African countries have no identified palliative care services. Only 90% would be classified as having services approaching to some measure of integration with mainstream health provision. To date, only 3 African countries, including Uganda, have palliative care integrated into their national health policies and strategies despite Africa's disease burden. Dr. Emmanuel Luyikira, Executive Director of African Palliative Care Association, says Uganda is the first country in Africa to introduce morphine in palliative care services and the first country to allow nurses to use morphine in relieving pain. As for Luyikira, Palliative Care Conference in Uganda is crucial as millions of patients and families eagerly await health services that address physical, social, psychological, spiritual pain and suffering of the sick and their families.
Uganda is one of the few countries that allow nurses to prescribe, but not only that. Uganda reconstitutes its own pain control medicine called morphine and then gives it out to patients free of charge, whether you are in a government facility or a non-government facility. So that's a big plus for us, and I think for us as a regional entity, we always use Uganda as a base of learning, so other countries come here and then they go back and practice.
Dr. Johnson Amone is an Assistant Commissioner, Curative Services, Minister of Health, intimates that a lot has been done in extending this service to Ugandans. Amone indicates that palliative care services have been integrated in various regional health facilities and can now be accessed in regional hospitals and at Hospice Uganda, a non-government organization with its headquarters in Kampala, caring for over 5,000 people in its 3 centers of Kampala, Hoima, and Mbarara. The African Palliative Care Association, working in collaboration with existing potential providers of palliative care services, is to expand service provision in Africa. It is also working with government policymakers to ensure the optimum policy and regulatory framework exists for the development of palliative care across Africa. Harris Tembo, WBS.